The healthcare system in the United States is unlike anything else in the world. It's not purely government run, and it's not purely a free market either. Instead, it's a patchwork of public programs, private insurers, and government oversight. That Frankenstein design essentially results in a system of layers that makes American healthcare much more expensive than healthcare in other wealthy countries. But that's okay, because we probably have better health outcomes in those countries, right? Right? That's the topic of this week's Healthcare Triage. Let's start by understanding the patchwork. Some Americans get insurance through employers and private companies. Others rely on public programs like Medicare for older adults and Medicaid for lower income populations, and sometimes both. Federal and state governments fund and regulate large parts of the system, while private insurers still negotiate prices, design benefits, and decide what gets covered. Policies like the Affordable Care Act expanded access to private insurance markets, while programs like Medicare and Medicaid remain publicly funded but are often delivered through private plans and providers. At every level, public and private financing are deeply intertwined. Sound complicated? That's because it is. And that's why we're combining the powers of my organization, Academy Health, with the powers of this channel to create a series that addresses the complicated pain points in the American healthcare system. Or, to be more frank, about all the shit that ticks us off about healthcare. Let's get to it. Framing the US healthcare system as either government-controlled or free market misses the point. It's a hybrid system, and that hybrid structure shapes nearly every debate about healthcare policy in the United States. Because government programs set rules and provide funding, politics are a heavy hitter in the healthcare debate. But because private companies still compete, negotiate prices, and manage insurance plans, market forces pack their own punch. This creates a lot of tension, and to say that it makes healthcare a politically charged issue is an understatement. And while that debate rages on, the cost of healthcare in America continues to rise faster than in any other wealthy nation. In 2024, the United States spent nearly 18% of its GDP on healthcare, roughly $5.3 trillion a year, or about $15,000 per person. The average among other high-income countries is closer to 10% of GDP. And if you think that it's worth it to get better health outcomes, I've got bad news. It doesn't work that way. Americans have shorter life expectancies, higher rates of mortality, and a number of chronic disease, and they sure don't feel like they're getting more than people in most peer nations. We're not getting more for our money. We often are getting less. And if that doesn't make you mad enough, much of that financial burden lands directly on patients through premiums, deductibles, and out-of-pocket costs. So unless we're seriously considering uprooting our lives entirely and moving to another country, are we just stuck in this mess? Not necessarily. The first step to solving a problem is understanding it. And understanding healthcare requires a specific kind of research. That's where health services research becomes essential. Health Services Research, or HSR for short, studies how healthcare is organized, delivered, and paid for. HSR asks questions like, why is healthcare so expensive? How do policies affect who gets care and who doesn't? What happens to patients as they move through the healthcare system? I wear a lot of hats, and most of you probably know my science communicator hat the best, but a significant portion of my career has also been spent on health services research. People like me analyze insurance structures, hospital pricing, administrative systems, and economic incentives, and what do we keep finding? That the high cost of healthcare in the United States can't be blamed on any single source. It's the result of multiple layers of the system interacting with each other. So let's dig in there. One of these layers is prices. Americans pay dramatically more than other nations for the same stuff. An MRI that costs a few $100s in Australia or the Netherlands can run $1,500 or more here. A hip replacement that costs $12,000 in France averages over $30,000 in the United States. Hospital stays, physician visits, and procedures all follow the same pattern. And it's the same with prescription drugs. Americans pay on average 2 to 3 times more for brand name medications than people in other wealthy nations, partly because other governments negotiate prices directly and the US usually doesn't. Another layer is administrative complexity. Because the US system involves many different insurers, payment rules, billing systems, etc., healthcare organizations have to execute a lot of administrative tasks just to process claims and payments. Hospitals have teams of people dedicated to billing, insurance verification, and reimbursement negotiations. Insurers do the same thing to handle things like claims reviews and benefit design. This layer adds cost before a patient ever even receives care. In fact, some estimates suggest that administrative costs account for about 30% of total US healthcare spending. This is huge compared to countries with simpler payment systems. Market concentration is yet another layer. Due to things like expansions or mergers, hospital systems have serious market power. When fewer competitors exist, providers can negotiate higher prices with insurers. We have the same problem with pharmaceutical and medical device companies. Limited competition allows high prices for specific products. Then there are incentives that shape patient behavior. High deductibles mean that patients have to fork over a lot of their own money before insurance kicks in. This is supposed to make people more cost conscious, but it's actually more likely to discourage them from seeking care until they don't have a choice. Patients might avoid the doctor to save money, waiting until a small issue becomes more serious. Unfortunately, at that point, it's probably also a lot more expensive to fix, and it's definitely more serious. And this might sound counterintuitive at first, but HSR has also identified areas where the US spends too little. This includes things like preventive care and investment in public health, both of which the US spends less money on compared to other wealthy countries. This plays a major role in long-term health outcomes, a negative role in our case. Perhaps most importantly, health services research examines where people fall through the cracks. Even though the United States spends enormous amounts on healthcare, gaps in coverage and affordability are still a big problem. People lose access to care because of employment changes, because they're ineligible for public programs, and or they're unable to afford the care they need. The point we want to drive home is that these gaps aren't accidents. They are literally by design. They directly reflect policy decisions, insurance structures, and market incentives. Policymakers decide how public programs are funded and who qualifies for them. Insurance companies determine which services are covered and how much patients pay before coverage applies. Hospitals set pricing structures and negotiate reimbursement rates with insurers. Each of these factors help determine how patients interact with and are affected by the system. HSR strives to identify where the system works and where it doesn't. That research helps us understand the drivers of access, cost, and quality of care. It also reveals key truths about the American healthcare system. The United States doesn't simply spend more because Americans use more healthcare or have access to better care. The US spends more because of how the system is structured, and because that structure combines both policy decisions and private market behavior, changing it requires understanding both. HSR doesn't provide a single easy solution. What it does provide is a clear understanding of how the system actually works, who's fallen through the cracks and why, and what it would take to make it better. Join us next week for an HSR take on healthcare after the One Big Beautiful Bill. Academy Health is all about making research matter, turning evidence into real-world impact on health and healthcare. That's exactly what healthcare triage is about too, breaking down the complex, sometimes messy health policy and research stories that affect all of us. Basically, we're tired of the nonsense, and that's why we've teamed up to bring you this important series. So let's bite the nonsense together. We'd really appreciate it if you'd like and subscribe down below, and consider on going to patreon.com/healthcaretriage, where you can help support the show, make it bigger and better. We'd especially like to thank our research associates Joshua Crow, Edward Liljeholm, and Christopher Learn, and especially our Surgeon Admiral, Sam.